Hello everyone, and thank you for joining me today for the Community Cessation Initiative Training. My name is Melissa Campbell, and I am the Community Cessation Initiative Coordinator at Huron County Public Health, and I will be going over the training with you today. Today we will be learning about the Community Cessation Initiative, or CCI, with some information on cessation, the referral process, information for tobacco cessation providers, and the billing and reimbursement process. CCI is a pilot program that is being offered by the Ohio Department of Health. This program will allow individuals to receive tobacco cessation services and relapse management follow-ups. The Ohio Department of Health is funding 5 CCI projects throughout Ohio. Huron, Erie, and Sandusky counties will be working together to get CCI up and running as the non-Appalachian Rural Awardee. Other funded projects include an Appalachian County Consortium, Carroll, Belmont, Jefferson, and Harrison counties, a multi-county consortium, Licking, Knox, and Perry, and 2 urban counties, Franklin and Lucas. The Ohio Department of Health has set goals for CCI, and the first is that all consumers, regardless if they are insured or not, are able to receive tobacco cessation services at no cost to themselves within a 10-mile radius of their home. Lead CCI agencies will serve as a central point to provide support and connection for people to tobacco cessation services. Huron County Public Health will develop a partnership with other community agencies to refer to for appropriate cessation services. Lastly, CCI hopes to create an integrated health planning process to allow for coordinated, comprehensive tobacco cessation services to take place in each community. From the provider stakeholder surveys, additional training on tobacco cessation was requested in certain areas. The next few slides will cover those areas, and there are links provided for each that can provide even more information if interested. All of the links for the slides will be sent separately, that way you can click on them and view them accordingly. Please click on the link to watch a short video on the health effects of quitting tobacco. This video explains the changes a person goes through starting even just 20 minutes after a person quits smoking. It is important to note that some effects of smoking are irreversible, but it can still help to reduce some risks that are faced by smokers. The first link provided comes from the Centers for Disease Control and Prevention. This link provides strategies to quit smoking. There are 4 different tabs on the main page, and this will allow you to find ways to help clients develop a quit plan, manage cravings, find social support, and clients can even receive text messages to assist with their quit attempts. This site also provides a mobile app download for a free quit guide. The second link is similar, but this site goes a little further into explaining creating a quit plan, deciding when to quit tobacco, and what methods are available to choose from when they decide to quit. Preparation is key when attempting to quit using tobacco. Therefore, assisting your client in creating a quit plan could provide great benefit. Creating a quit plan includes setting a quit date, telling friends and family members, deciding if nicotine replacement therapy or NRT will be used, setting up counseling appointments, and setting up a social support system. Social support is important in quitting, and using these resources will help you to explain to tobacco users that while it may be hard to ask for help from family or friends, it can make it easier to quit if you have support. One method of intervention is the 5 A's. The 5 A's are ask, advise, assess, assist, and arrange. Using the 5 A's can help to start a successful quit attempt for tobacco users. Ask each patient each time if they are a tobacco user. For those who are, advise with a strong, personalized message that they should quit using tobacco. Assess the situation. Find out, are they willing to quit? Assist those who are willing to quit tobacco usage. Explain what services are available to them, such as individual counseling, group counseling, pharmacotherapy, and assist them with participating in those available services. Lastly, arrange follow-up meetings or phone calls, and try to have this arranged within 1 week of their quit date. More detailed information on the 5 A's can be found on the link listed on the slide. It is possible that if clients are motivated, they may quit using tobacco. Use the 5 R's: relevance, risks, rewards, roadblocks, and repetition as a form of motivational interviewing to get those who are not ready to quit motivated to quit. Use relevant examples as encouragement to get them to quit. Involve the patient and ask them to identify what risks are involved in using tobacco and what rewards or benefits they would have from quitting tobacco products. Continue to ask the patient if they would face any roadblocks or barriers to quitting. Lastly, repetition is key in getting tobacco users motivated to quit. Keep using motivational interventions each time a tobacco user is unmotivated to quit or they fail their quit attempts. Smokefree.gov provides information on different quit methods that are available to tobacco users. Some of the available quit methods include in-person counseling, telephonic counseling, and pharmacotherapy. This site lists each available quit method and provides many tools and tips to assist with quitting tobacco use. Smokefree.gov is a resourceful tool for different populations of smokers. There's a site for veterans, women, those who are 60 years of age and older, and there is a Spanish version. The different types of quit methods include in-person counseling, which is attending face-to-face meetings at doctor appointments, local hospitals, health departments, or other local agencies. These can be done individually or in a group. Telephonic counseling. This is receiving tobacco cessation guidance by someone over the phone. The Ohio Quit Line provides personal quit coaching for tobacco cessation. Nicotine replacement therapy, or NRT, uses items such as gum, patches, and lozenges to reduce nicotine withdrawal symptoms. These items do contain nicotine, but not the other harmful chemicals that are found in tobacco. Prescription-only medication. These medications can help to alleviate nicotine withdrawal symptoms and block the effects of nicotine from cigarettes and stop the urges to smoke. The FDA has approved medications that are available to those who want to quit using tobacco. Nicotine replacement therapy is available to help wean tobacco users off tobacco. NRT products are available over the counter and by prescription. The FDA has approved 5 types of NRT, and they are skin patches, chewing gum, lozenges, nasal spray, and inhalers. The FDA has approved 2 prescription medications for cessation that do not include nicotine, and those products are Zyban and Chantix. These tablet form medications are available by prescription only. The CDC has provided a useful resource to find information for different subpopulations. These subpopulations include African Americans, Hispanics, people of low socioeconomic status, LGBTQ, and adults with mental illness and substance abuse disorders. Each link provides information on the prevalence ratios of using tobacco for the subpopulation, patterns of tobacco use, health effects, and quitting behaviors. The CCI project in Huron County will be focusing on 4 disparate populations: the socioeconomically disadvantaged, Hispanic residents, individuals with disabilities or mental health illnesses, and pregnant women to target for education, awareness, and promotion of tobacco cessation. Some considerations to be made when attempting to target these populations include: for socioeconomically disadvantaged, focus on the monetary savings that come with quitting, since money is likely a stressor for this population. For Hispanic residents, ensure messages are culturally appropriate and reinforced by trusted community leaders. Individuals with disabilities or mental health illnesses, individually tailor flexible cessation options for this population, and utilize family members or friends to be an influence for cessation. For pregnant women, educate women on the detrimental effects smoking has on them and the baby. Distribute information to places that already serve pregnant women to increase outreach. Huron County Public Health will be partnering with many local agencies as referral partners for CCI services. These agencies will serve our population but do not provide direct cessation services, and thus will refer their clients to the program to receive services. You are probably wondering now, why should my agency be a referral partner for CCI services? Being a referral partner can help you to connect your clients who would like to quit using tobacco to local cessation services. Referral partners are essential to have in order to reach more tobacco users and refer them to services. If a client expresses interest in quitting tobacco or asks if there are any available options to quit using tobacco, they can receive an explanation of CCI and be referred into the program. In order to make a referral to CCI, the referral partner must complete the tobacco CCI referral form and fax or email the form to Huron County Public Health within 24 hours of taking the referral. The CCI coordinator will then contact the interested client and get them started with CCI services. This is our referral form for tobacco CCI services. The top portion is to be completed by the person making the referral for the client. The client section must be completed with the client's information. The referring agency can assist the client with filling this out, but the client does need to sign the form to give consent to have their information shared with Huron County Public Health and CCI partners. The referring agency then must submit the form to Huron County Public Health, and the CCI coordinator will be in contact with the client within 24 hours of receiving the referral form. We can accept phone referrals, and patients can self-refer. If an organization would like to become a referral partner to refer clients to Huron County Public Health for CCI services, Huron County Public Health needs to have a stakeholder survey on file, which tells us basic information about the agency and if tobacco cessation services are offered. In order to share information about tobacco users' quit attempts, data sharing agreements will need to be signed. If a referral partner will be making referrals and does not need any follow-up information on the clients, this will not be needed. Referral partners are required to complete necessary trainings, this training being one of them, as well as evaluation surveys and site visits. If your agency is solely a referral partner for Huron County Public Health for CCI services, please click on the next slide and take the referral-only post-training survey. All cessation providers, please skip the referral-only post-training survey and continue on to complete the remainder of this training. All referral-only partners must complete the training survey. Please utilize the link provided to be directed to SurveyMonkey for a brief survey. If you have any questions or would like any additional information, please send an email to cci@huroncohealth.com. In this next section, we will discuss provisions of service, required documents, and billing and reimbursement for CCI cessation providers. Why should I be a provider of cessation services with CCI? Well, first, your agency can get reimbursed at Medicaid rates for denied claims and for those who are uninsured. In addition, Huron County Public Health will provide follow-up calls for all CCI participants at 1, 2, 4, 5, 9, 18, and 24 months, and can provide information on the follow-ups to providers so you will know how your client is doing even 2 years out. Providing cessation services can be a step in helping more people quit using tobacco in your community. If you choose to be a tobacco cessation service provider through the CCI project, there are 2 different service provisions: on-the-spot service provision and the service provision via referrals. In order for an on-the-spot service to be considered CCI, a Huron County Public Health HIPAA form, consent form, and an intake survey must be completed first. Huron County Public Health will provide each provider with paper copies of the consent forms, which must be read to each client, a paper intake survey, and a consent document. The signed consent document must be signed by the person who read the consent to the client. Any cessation services completed before these items are completed are not considered CCI and cannot be reimbursed by CCI or the Ohio Department of Health. All completed documents must be emailed or faxed to Huron County Public Health within 72 hours of completion. When a client is receiving CCI services from a CCI provider, the Huron County Public Health HIPAA form must be signed by the client at their first appointment. This form must be signed by the client regardless if the provider is completing the other paperwork that we will discuss on the next slides. This HIPAA form gives Huron County Public Health and all CCI partners and agencies permission to share and exchange the client's information. The signed HIPAA form expires 3 years after the date that it is signed. For on-the-spot services, this first consent form must be read to the potential CCI client. The intake introduction consent script will explain to the client that CCI is a program that helps tobacco users find local services to help them quit. All services are free to the clients, and this explains that we will be asking them questions about tobacco usage and demographics in order to find a cessation service that best meets their needs. Lastly, this consent form explains that the Strategic Research Group, or SRG, will be evaluating the program, and clients will only be identifiable to SRG by a number and not their name. If you read this to the client and they decide they do not want to participate, you do not have to do the intake survey. You are able to provide cessation services to the client, they just cannot be a part of CCI. If the client gives verbal consent, please continue on to the intake survey. Here is a sample of what the intake form looks like. There are additional pages as well. The intake survey should take about 15 to 20 minutes to complete. Please try to answer as many questions as possible. There is skip logic involved, so please try your best to follow it. The client name can be entered where it says Client ID. The client is not obligated to answer any questions they do not want to. The second consent document must be read to the client to obtain verbal consent for follow-ups on the client's experience in the program. This consent form will allow for SRG to follow up with the clients at 3, 6, and 12 months for evaluation of both the program and their quit attempt. Not all clients will be followed up with by SRG. Clients will receive a letter with phone numbers for SRG they can call with questions. If a client does not consent to this follow-up, they can still be a part of CCI and still will receive relapse prevention calls by the CCI coordinator at Huron County Public Health. The contact information form must be filled out for all clients. That way Huron County Public Health can complete the relapse prevention calls. If the client consents to follow-ups from SRG, the information on this form will be given to SRG. Otherwise, it will only be used by Huron County Public Health. Lastly, the signed consent document shown must be filled out and signed by the person reading the consent documents to the CCI client. This form will need to be sent to SRG, so please make sure that you do not enter anything on the client ID line. The CCI coordinator will enter the proper ID number for the client. After all of these forms are completed, CCI services can begin. All of the mentioned documents must be sent to Huron County Public Health by email or fax. Again, if these forms are not completed before services begin, those services cannot be included as part of CCI, and any denied or uninsured claims cannot be counted. However, anything after the completed consent and intake forms are completed, these services can be a part of CCI. In the event the provider chooses not to fill out the consent forms and intake survey, they can just refer the client to Huron County Public Health, and we will complete all paperwork, which is the consent forms and the intake survey. Then we will refer the client back to the provider for cessation services. Or a client may be referred to the provider through self-referral or other referral partners. Huron County Public Health can receive referrals from other referral partners and refer them to your agency for CCI services, depending on availability noted in the provider summaries. Depending on the preference of the provider, clients can be referred in 3 different ways. First, the CCI coordinator can call the provider and set up the appointment. Next, the CCI coordinator can give the provider information to the client, and they can call and set the appointment up on their own. Lastly, the CCI coordinator can contact the provider and give the information of the client, and the provider can call and make the appointment. These methods will vary per provider. Billing is an important component of CCI after services are rendered. For providers that will be billing, this flowchart explains the billing process for CCI. Once the provider agreements are signed by Huron County Public Health and the provider will provide cessation services and bill the appropriate source of insurance. The provider must bill the client's insurance first using the proper tobacco cessation codes, and if the claims are approved, the provider receives payment from those sources. In the event of a denied claim or uninsured clients, the provider must send over proper documentation discussed on a latter slide to Huron County Public Health, who will then compile the denied claims along with uninsured claims and send them to the Ohio Department of Health on a quarterly basis. If claims are approved, and once Huron County Public Health receives payment for the claims from ODH, payment will be remitted back to the providers. As mentioned on the previous slide, the Ohio Department of Health will allow providers to bill for denied claims and uninsured patients for evidence-based services, including individual, group, and telephonic counseling for tobacco cessation. Providers may not bill Huron County Public Health or ODH for nicotine replacement therapy. Providers must meet the core service requirements in order for those services to be considered CCI. The table provided shows the core services for CCI. This shows the requirements for counseling for individual, group, and telephonic in order to bill for these services. Following this guide will help to ensure that any denied claims or uninsured claims will be reimbursed. The CCI project allows for uninsured individuals to receive tobacco cessation and relapse management at no cost to themselves. All services provided to uninsured individuals should be in the same way as they would be for those who are insured. Claims for uninsured need to be sent to Huron County Public Health, and the information that must be sent over is the patient name, date of service, type of service the client received, the enabling services requested, enabling services provided, and the reimbursement amount requested. A form will be given to providers to fill out all of the necessary information for the uninsured claim, and these will need to be returned to Huron County Public Health before quarterly expenditure reports are due. The remaining dates in 2018 to have these submitted to us are listed in the provider agreements. Some claims for tobacco cessation made to insurance sources may get denied. Unavoidable reasons a claim could get denied would be that the client has exceeded their limits of coverage for tobacco cessation, they are not a member of the provided insurance, or a duplicate claim has been sent in. Some of these denials can be avoided by making sure the items being billed are coded properly and reviewing the coverage available. CCI clients will not be required to pay co-payments or co-insurance for CCI services. CCI services on most insurances are considered preventative care, which would not be subject to a co-payment. Denials for co-payments and deductibles not being met can be billed to Huron County Public Health, and providers should not collect any money from CCI clients, and the CCI client should not receive a bill for services. Again, the Ohio Department of Health will not reimburse for prescription medications. In order to submit a denied claim to Huron County Public Health, all of the information listed on the slide is necessary to submit a claim for payment. A form will be provided to providers to ensure all information is there. Otherwise, the denied claim may not be reimbursed for. Huron County Public Health will submit the denied and uninsured claims to ODH on a quarterly basis. Please refer to your provider agreements for the dates the claims must be received by Huron County Public Health to be included in the quarterly report. Any claim for uninsured or that gets denied will be reimbursed to the provider at the current Medicaid rates for service. These rates are subject to change, and the provider will be reimbursed the rate from the date that the service was provided. This chart shows the current Medicaid reimbursement rates that will be paid to the provider for any denied or uninsured claim submitted to Huron County Public Health. Please note that these rates are subject to change, therefore, all reimbursements will be paid at the rate for the day the service was provided. In order to be a provider of CCI tobacco cessation services, providers must complete the stakeholder survey that was sent by email. A provider summary document must be filled out with Huron County Public Health, which will state what services you can provide and the estimate number of appointments you are able to offer in a given period of time. If the provider bills Medicaid, a letter certifying that Medicaid is billed and what codes and plans your agency is credentialed with is needed. A data sharing agreement is required between Huron County Public Health and the provider in order to share information. Once all of these items have been completed, Huron County Public Health can begin to refer clients to your agency for CCI services. Each cessation provider will be required to fill out cessation provider services forms. This form will be due to Huron County Public Health on a weekly basis. To fill out this form, the provider and month covered must be filled in. For each session of CCI services provided, this form must be completed. The client's name or ID, type of service they received, which would be individual, group, or telephonic counseling, the date of the actual service, if the client's insurance was billed, and the last column only needs to be filled out if the client's insurance was not billed. The reason the client's insurance was not billed must be listed. Some reasons this could be the client is uninsured or the organization does not bill for cessation services. Huron County Public Health can email, fax, or drop off these forms to each cessation provider. The cessation provider can email or fax the completed forms bi-weekly to Huron County Public Health. Thank you for taking the time today to complete this training. There are a few questions that must be answered by everyone taking this training. Please click on the link provided to complete the post-training questions and direct any questions on the CCI project to Huron County Public Health by email to cci@huroncohealth.com.